There are two things you need to pick up to heal your oral piercings. One is a brand new unused toothbrush. The second is a gallon of distilled water. Make sure the toothbrush you are going to be using is new and unused so there's no chemicals or germs from previous uses on it. If you have a mechanical toothbrush you normally use, you can use a manual one you can pick up from the dollar store, and then go back to your mechanical one once it is healed. Oral aftercare is much different, but trust us, it works. Anytime you eat, drink, or smoke, rinse with distilled water and spit it out. When you have a meal, brush your teeth with that brand new unused toothbrush you're going to pick up, rinse and spit. No mouthwash, no toothpaste during the entire healing process. This may sound odd, but fluoride, chlorine, and bleaching agents can cause irritation on open wounds, especially in your mouth. Because you're constantly flushing all the food particles and drink particles out of your mouth, that will lower bacteria levels. The lower the bacteria levels are, the faster your mouth and your oral piercing can heal. If you want fresh breath, what you can do is after you brush your teeth with distilled water and that toothbrush, you can pop a couple of breath mints. Be sure to rinse your mouth immediately after with distilled water to get the excess out of your mouth, but then you can have minty fresh breath. There are certain things to avoid while healing an oral piercing. No open mouth kissing. Human mouths have a lot of bacteria. You may need to stay away from sugary, spicy, high acidic foods and or drinks. So if you're eating something and it hurts, try to avoid those. Playing with your piercings. Do not play with it. Pushing on the piercing with your tongue or rattling it against your teeth can cause damage not only to the piercing but to your teeth as well. Oral sex. You need to avoid performing oral sex. That part of the human body has a lot of bacteria and can cause some bacterial infections on your fresh wound. Another thing you can do to help your body heal is to stay in good health. Eat well, sleep well, and take a multivitamin. The healthier you are, the healthier your piercing is. The faster your piercing heals, the less chance there is for scarring or infection. It is very important for you to follow up with your piercer. The initial jewelry you are leaving with is a little bit long to accommodate for swelling. Once the swelling resides, that post can be too long and can be problematic for the healing process. We ask that you follow up with us virtually first. Take clear and focused photos of the front, of the side where you see both front and back of the jewelry, and the back of the jewelry. The trick is not to fold your piercing over, pinch to zoom so it's clear and in focus. Email that over to us and we'll let you know how it's doing. Tongue piercings should be followed up with photos 2 weeks after initial piercings. All other lip piercings should be followed up with photos 2 to 3 weeks after initial piercings. Please remember these are done virtually. Excessive length on the jewelry can be problematic after initial swelling. You must follow up with the piercer as instructed. Not following up with us can cause irritation and migration outside of our control. This will void our guarantee.